Okay, let's move to the favorite part of me. So the calorie deficit, as I said, 500 to 1000 less from the usual intake. Okay, that could helps with weight loss and also prevent the weight gain. And then we want to reduce the fat intake, and then there's also very low calorie diet, which the patient will only consume 200 to 800 kilocalorie per day. Okay, so this one we suggest for patient who moderate to severely obese patient. Okay, and then physical activity is very important in weight loss therapy, and because by doing physical activity we can actually decrease the abdominal fat and also increase the fitness of cardiorespiratory. All right, so for patients who are aiming for weight loss, we advising them to exercise about 45 to 60 minutes per day of moderate intensity activity. What is defined by moderate? For example, like gardener or patient who actually live quite heavy stuff in their daily life. Alright, mainly not sitting lah. Okay, what about the lifestyle? Lifestyle advice. What do we want to know about weight loss in our daily activity? Is that we want to decrease the calorie consumed and also increase the energy expended. Okay, so we can use this low calorie diet. Low calorie meaning it's deficit 500 to 1 kilocalorie per day. Sometimes it's about 1200 to 1500. So what it means by if that person consume 1500, so if you want to achieve weight loss you need to take only 1000 kilocalorie, like that lah. Okay, and that's how we prevent the weight gain. Okay, and then for the abdominal fat, no, there's nothing about this. Okay, so waist circumference, we aiming to reduce 1.5 to 9.5 in 6 to 12 months. But this differ also. This differ based on the sex, the age, and also the genetic. Because men, as we all know, they have higher energy expenditure, so they lose more energy expend than the female, and older patient their metabolism is less than the younger, so that needs to put. Okay, this is the one that I want to talk about, table 4.1, the calorie requirement for weight reduction. Okay, let's say patient who are having a sedentary lifestyle, meaning patient who sit most of the day and only lift a very light object. For example, patients who are working in the office, even nurses and students, that are example of sedentary lifestyle. So if that person is within normal weight, the energy requirement per day is 30 kilocalorie per kilogram. Let's say if you are 70 kilogram, right? So if you require 30 kilocalorie, that means you require 2100 kilocalorie. Is that correct? Is that correct, guys? Am I doing the right math? Yes, 2100 kilocalorie per day. So if you want to achieve weight loss, you need to deficit 500 to 1000 calorie per day. Yeah, guys, I think my math is still correct. If that patient is overweight patient, then require less than that. So yeah, you can do your math. If patient is having marked activity, they require quite more than that, than the sedentary lifestyle. Okay, so and then we have another one, lower fat diet, and this one I want to emphasize a very low calorie diet. Why is it? Is patient who only consume 200 to 800 kilocalorie per day, and usually this they consume the diet in liquid. supplement. Okay, and of course if you only consume that much of calorie, you will achieve rapid weight loss. But this is only appropriate not to all patients, but only for patients who have major health risk. Okay, and must be supervision. So what's the expectation is when we apply the very low calorie diet, we are approximately going to achieve the weight loss of 20 kilograms in 12 weeks, meaning in 3 months only 20 kilograms. Previously 7 kilograms in 6 months in normal people. Okay, I mean not normal but in obese who are 70 kilograms. Okay, and this one is highlighted in pink, not usually recommended, very low calorie diet in patients who not recommended because it can lead to nutritional inadequacy. It's not suitable for a long period, and it can also increase the serum uric acid and also cause the muscle breakdown. So these following patients, they are not suitable, are contraindicated for very low calorie diet. Patients who have myocardial infarction, cardiac conduction disorder, cerebrovascular, renal, diabetes mellitus here one, and psychiatric disorder. So a very low calorie diet is only for patients who are severely obese patients, okay, who are highly motivated and would probably respond to the rapid weight loss. And then how about the physical activity? Physical activity for patient, what they can do is we must introduce the exercise gradually, okay, not sudden. You can cause yeah lah, not sudden lah, just gradually. And then what they must be advised, if they never exercised before, they could respond to chest pain, excessive breathlessness. Okay, so that's why we need to start it gradually. Usually about 30 minutes of regular moderate intensity, and then yeah, of all days of the week. So by doing this, we can prevent the weight gain in formerly obese who require 60 to 90 minutes per day. Okay, and then for daily walking, what we can introduce for them at first is regimen of daily walking. What am I talking? I cannot speak correct. Okay, whatever. Okay, so you can start 10 minutes first, 3 days a week, and then gradually up to 30 minutes and like that lah. So these are 3 examples of light, moderate, and high exercises. For light, like walking, you can do tai chi, house cleaning. And then for moderate, it's like brisk walking of 10 minutes per kilometer, and then active gardening, alright, and badminton, swimming. Jogging is high energy, okay, like walking uphill, naik bukit, that one. Okay, and also they must accompanied by flexibility, strength, and also aerobic exercises. So we must maintain the exercises at least 1 to 2 weeks. If we progress too rapidly, will only cause muscle soreness, cardiac risk, and also decrease motivation. And we must do warm up and cool down, and also drink plenty of water before and after exercises. So we have this behavioral therapy, counseling, etc, etc. And then what are the behavioral therapy apart from counseling? We have self-monitoring, portion control, stimulus control, contingency management, stress, cognitive behavior, and weight loss support group. Okay, let's move to our final part, the pharmacotherapy. Pharmacotherapy, it consists of for patients who are 27.5, and we have surgery for patients who are 40, or if 30 to 40 patients who have related comorbidity. The indication, patient who require pharmacotherapy is when patient already diet and exercise for 6 months but failed. Okay, and then patient who the comorbids are type 2 diabetes mellitus, coronary heart disease, hypertension, and then they have osteoarthritis, obstructive sleep apnea. Okay, by doing the pharmacotherapy, our expectation is they can 2 kilogram, they can lose 2 kilogram in the first month, and more than 5% by 3 to 6 months, and also no weight gain. So our anti-obesity drug basically reduce the fat absorption and also suppress the appetite. And we have a few here, so I'm not going to go through one by one. Let's just go over here. There's a summary over here. Okay, you can turn your mobile phone sideways like this. So the first one we have orlistat, okay, sibutramine, phentermine, fluoxetine, metformin. Is there some more? No, that's all. Okay, I guess I want to say that we also have this anti-obesity which are still underdeveloped, like neuropeptide Y, glucagon, and battery adrenergic. Yeah, that's a few things. So basically, yeah. And the surgery, the last one, surgery. What type of surgery we doing this is we have look, you can focus at 5.2.2. We have gastric partitioning, vertical gastric banding, gastric bypass, Roux-en-Y, biliopancreatic bypass procedure, and also last one we have laparoscopic insertion. Regarding liposuction, it's not a treatment for obesity, but it's all for unsightly local portion of fat. It's basically for cosmetic. But the downside about surgery is that it can cause malabsorption. Okay, because patient can have nutrient deficiency and then dumping syndrome. So we actually encourage them to take multivitamin supplement. So other complications are like anemia, stenosis, weight loss, and surgical failure, and some of the metabolic. Yeah, that's all. And also childhood, last one. Childhood, they don't have the same management as the adult, because basically childhood you need to manage it by reduce the energy intake, increase the energy expenditure, and very important one is behavior. They say that child, even if they are obese, they will outgrow it, but we still need to pay attention to them also. Yeah, that's all. And then limit television and must involve the family also. Alright, yeah, I think that's all the one that I want to highlight in this CPG. And then two these two points, I really like it. For children, we should not provide food as a reward and do not offer sweets in exchange of finished meal. Alright guys, thank you for watching and listening. I'll see you guys very soon. Bye!